My name is Deanna Holmes, and I am the parent of a patient. Mason's patient experience started at birth. So when Mason was born at 26 weeks, there were all these complications that automatically come along with having a micropreemie baby. But he had bronchopulmonary dysplasia, he required a PDA ligation, he had jaundice, he couldn't eat. He was on a ventilator for months because his lungs weren't developed enough to breathe on his own, and he had a grade 1 cranial hemorrhage. About 4 months into his NICU stay, after we tried all these different things to kind of get him to breathe on his own, it was decided that he needed a trach. To me, a trach was the scariest thing in the whole wide world. It's an actual hole in a person's neck, and not just a person, a baby. My baby was going to have a hole put in his neck. I was confronted with the realization that my child might not live.
My name is David Andrews. I was a patient advisor for over 10 years. A little over 20 years ago, I noticed I had a weakness in my legs that was clearly not just from being inactive. And we eventually figured out that it was a neurological problem. It wasn't something that was going to be fixed, but it was something I was going to have to live with. It was really important that the doctors understood that this wasn't just about naming my disease and identifying a treatment. It was also about the whole me and all the implications. If you've got a doctor that recognizes that you have a life beyond the examination room, the diagnosis, and the treatment, then you can begin to feel as though you and the doctor are working together to deal with your issues rather than you're just for the doctor to identify a disease and then prescribe a treatment.
My name is Victoria Baskett, and I am the founder and president of the Victoria Baskett Patient Safety Foundation. My length of diagnosis actually happened over a 3-day span. I went to 5 different healthcare providers in 3 days before I figured out that I had Ludwig's angina, and I was rushed immediately into surgery. Ludwig's angina is an infection in the floor of your mouth that spreads through your neck tissue and closes your airway. Typically 30 minutes onset of Ludwig's angina is fatal, but because I had been going to different healthcare providers and had been receiving antibiotics for strep throat, it was actually slowing down the infection. I didn't realize how serious it was in that moment until they started going through forms with me, and he looked at me and asked me if I had a do not resuscitate on file. And at 19 years old, I had no idea what that was. And I ended up coming out on life support.
My name is Shari Berman. I'm a 2-time cancer survivor. I just wasn't feeling well. And when I returned from my honeymoon, I had just become even more debilitated and decided to go back to the doctor. And he said to me, "You have a large mass in your left lung." And the world just started spinning at this point, and I couldn't believe what he was saying, and he said there's a good possibility it could be a form of lymphoma. The protocol was 6 months of pretty intense chemotherapy and 5 weeks of radiation. So when I was 5 years out, I started to really feel more confident in my future, and at that point we decided to start a family. And when my boys were 1 and 3, I had this itch under my arm, and I just went to scratch it and found a lump. I've been diagnosed twice, and I can tell you that it's the scariest thing.
Because I moved to this area and I have this rare disease, I decided I would bring all my care to a teaching hospital here. And what I noticed was that my average wait time before anybody saw me was over an hour. So I found the CEO's email. I got a call from somebody saying, "How would you like to join our patient advisor group?"
Quickly after this happened, started a platform, kind of a social media campaign, and it was telling people health tips and sharing my story and reaching out and really trying to make an impact, and it eventually transformed into my nonprofit, working to improve patient safety by teaching patients and families the importance of speaking up and finding their voice and being involved in their health care.
My mother was diagnosed with stage 4 lung cancer, and again, this was such a shock, but on such a different level. And so immediately I kind of went into the mode of her advocate, Because of my past experience, I felt like I really knew how to navigate the system.
I just knew that I had to share my story. I believe as people were impacted the most by other people's stories, and I knew if I could use mine to save just one life.
I decided I wanted to speak up, I wanted to make a difference, I wanted to make the experience better.
I have the opportunity to walk into a meeting with a completely different perspective than most people sitting around the table, and I always try to bring the voice of the patient and family, always.
There was a genuine interest in what patients thought as a vehicle for trying to improve the quality of the care and also the quality of the patient experience.
I think the patient voice is really important in the experience.
You can't provide good care unless you listen to your patients.
Try things from a different perspective, to come in at a different angle, and it can potentially impact that patient's experience, but it can also save that patient's life.
In those moments when you are provided with an exceptional experience, you can breathe. Patient experience has kept me whole. It's helped me be able to be a parent.
The patient experience is everything that happens in connection with your health care.
Patient experience to me is really the culmination of all of the different providers I saw. Every interaction I've had with healthcare providers.
Dr. Shulman was someone who I made a connection with immediately.
It's how you make the appointment,
When you walk in the door,
how you find the facility,
who you meet at the desk.
how you get your car parked.
It's showing care to the human that's sitting in the room.
Treating you as a whole person.
The kind of human interaction that you have.
So, I mean, to me, patient experience it's everything.
My name is Victoria Baskett, and this is my patient experience.
My name is David Andrews, and this is my patient experience.
My name is Shari Berman, and this is my patient experience.
My name is Deanna Holmes, and this is my patient experience.